Go ahead.
All right, here we are recording, and we're recording live. You're probably not watching live because we had technical difficulties. So but we're here with the first episode of American Dreamin', little video show here. And right now we're focusing a lot on the coronavirus. We have, obviously this show is, the goal for me is to talk about real estate and finance long term. But right now we got something bigger and more important that we're dealing with. So we have three guests tonight. We'll start with Nate Gearhart. I've known Nate for a long time. So Nate is a teacher and a mentor in China. Tell us exactly where you're at, Nate.
We're in Wuxi, Jiangsu Province, about 2 hours west of Shanghai.
Okay. And how far are you from this epicenter of this outbreak?
So Wuhan and Hubei Province are a fairly large distance away from us. There's a province between us and Hubei Province. So it's about 500 kilometers away from our home here.
All right. And then we have Kevin Usealman, Legacy Real Estate. He is a real estate agent in Davison, Michigan. Been doing that for a while. Before that, he was a TV personality, could I say? A newscaster, a weatherman. He's a jack of all trades. I haven't seen him behind the camera before. So how you doing tonight, Kevin?
I'm good, Jeff. It's good to see you, and I'm very impressed at your hard work to set all this up. Thank you.
It didn't work out like we wanted, but we'll make the best of it. All right, then we have Beth Brown, who I've known for a while. She is a nurse at Genesis. Well, we call it Ascension Genesis now. They've changed that. And how long have you been nursing, Beth? How long have you been doing
I've been a nurse at this hospital for about 2.5 years.
Okay. All right. So basically, we just want to talk about, how the virus is affecting each one of us and different things, different questions we can ask that would obviously pertain differently to each one of us. I'll start with you, Kevin, since obviously we kind of wanted to do this as a real estate show originally. How is the real estate market affected by this outbreak?
Well, Jeff, essentially right now we are operating only within the constraints of the governor's stay-at-home, stay-safe orders. So what that means for us is that we are limited by the language of the order, and the state association has issued some clarifications. It's been kind of more than kind of a fluid process. As you can imagine, agents have lots of questions, brokers have lots of questions about what we can and can't do. So for folks who are watching, who are wondering things like, can I sell a home right now? The answer is yes. I just can't show it. So that makes things a little bit difficult. So for anyone who's looking to list a home, we can answer questions. We can do a market analysis on your home. We can talk about what a good strategy might be for when we do eventually come out of this, which is also open-ended, so it presents all kinds of issues there. The governor's order goes through the 14th, I believe, of April, but I think everyone realizes that more than likely we're going to be in this situation longer than that. So we're kind of by the seat of our pants for transactions that are already in process. I'm not going to spend too much time on that because I think if people are in process, they're already aware of this, but we can close transactions. The real estate agents just cannot attend. Kind of an interesting fact of this is initially title agencies and lenders were deemed essential. In a subsequent clarification 2 days ago,
lenders. We're essential.
I know, right? In a subsequent clarification 2 days ago, inspectors and appraisers were deemed essential. So now all aspects of the real estate transaction are deemed essential under the executive order, except for the agent. So
I thought you were going to say that lenders weren't because someone tried to tell me that they read that we aren't. So it is.
Well, I know all about your usefulness, and that's a separate issue. But I will tell you that we are able to complete transactions that are already in process. And for folks who want to buy a home, which is the final question that I get, we can do that. But it essentially, anyway, aside from things that I can't be involved in, has to be sight unseen. One of the tricks that some of us are using is sending home inspectors who are essential to the home, setting up a Zoom meeting like this or a video conference, and using the inspector as the eyes for the buyer. the transaction contingent on inspection as normal.
So it's a little tricky. I just, I've had experience buying things online, and as we all know, sometimes they're great, they're what you expect, and sometimes they're not. So I imagine a lot of people are hesitant on a house to do something like that. Beth, for instance, Beth bought a house not too long ago. I wonder if she'd have liked to do that without walking through.
I don't know.
Yeah, most people are waiting. It's a tough time. People are nervous about what will happen with prices. I think the general thinking is that this is a temporary situation. So sellers aren't going to give their homes away, even though there isn't a lot of buyer volume right now. I think we're just in a holding pattern, and the thinking is, and of course we never know fully, right? But the thinking is that there'll be quite the wave when all of this finally ends and we can all work again.
Right, and then we're restricted right now, so that kind of takes you up to Nathan here, and you are far away from this epicenter, but were all the restrictions for everyone or a certain geographical area within China?
Yeah, it came in a wave, and so as early as Chinese New Year, the end of January, we started to see life just shutting down. And it was hard to tell because Chinese New Year actually, like all businesses, almost local businesses, close because migrant workers leave, and you can't even go to a restaurant because all the servers are gone. But we started to see that actually it was not just the New Year's kind of clear out. It was more than that. In Wuhan, in Hubei province, there was a pretty intensive lockdown where there was just no traffic. People were not able. Pretty much everybody in China lives in a gated apartment complex. Whatever economic bracket you're in, you still live in a gated complex, and people weren't allowed in and out of those within Wuhan and Hubei. But then in our region here, it wasn't that strict. We could get out to grocery stores still. There was a discouragement of a lot of travel. There weren't a lot of businesses open. Only essential things like groceries and that were open. So there wasn't anywhere to go much other than that. There were other places in the country that actually gave you like a ticket, so you had one trip out of your gate a week to go stock up and come back. So I had some friends in other cities who were in that situation. Ours was pretty relaxed. And now we're on the other side where things are opening up. I went to Starbucks, I think 2 weeks ago for the first time, and I started to lean in a conversation talking to a guy who was next to me, and one of the people from Starbucks came and said, hey, make sure you keep that 1 meter distance between you. Reminded me of back when I was at a really conservative Bible college and had somebody watching over a date with a girl to make sure I don't get too close to her.
Leave room for the Holy Ghost.
It was just really it's yeah. So at this point now, they still do temperature checks on our way in and out of the gate, but it's totally, the Chinese word for it is totally 仪式化. It's just a ritual. They don't even look at the temperature, so it's just to show something's being done, which, I mean, it does have an effect. Like, continuing to do that stuff shows that, hey, there's still a problem here. We're still trying to do something about it. But it's not actually, I don't think they've ever caught anybody with a fever.
Nathan, can I ask you a question? I saw a news report that it showed drones flying around and telling people to get inside, or put a mask on. Is that something that's happening everywhere? Was that just
Not in our city. I've seen those, and I would say that those would be places, countryside places, really out a distance from a city, especially places where it's difficult to get an older generation of Chinese to comprehend what's going on.
Right.
And it was by far not universal across the country. Yeah. But that's the nature of China. Like, for years, people have been saying, you know, say whatever you want about China. Somewhere it's true, but that doesn't mean it's uniform across the country.
I
I've
mentioned
seen those too, but it was a movie.
Yeah.
A couple movies. They had guns on them. That's not happening. That's good.
No, it's not happening.
So Nate, I saw a report where they were talking about some of the places that are opening up, and they had a grid of tape on the ground and 6 feet apart approximately. I know you're talking meters, and everyone had a little chair to sit on for lunch. All these factory workers, they took their mask off. They're sitting down eating where all these lines intersected. So every corner of each square, there's like 200 people. Is that how? I mean, they are pretty strict.
Yep.
It's probably a lot different than what you hear from your family here when you talk to your family here about what's going on.
Yeah, I think it's a good illustration. It's not that way everywhere. I've not been in a factory myself recently to see that kind of thing. In our apartment complex, there's a center where packages are delivered when we order from Taobao, you know, from like Amazon. Packages get delivered there, and they did have a tape line, you know, showing 1 meter, 1 meter, 1 meter to queue up there. And so there has been some of that, but what that represents, I think, is kind of that doing something. I mean, we all feel like we need to do something about this, and that's one thing that Chinese society and the government has done to make a show of doing something about this. But it's also something that Chinese culture is a lot more oriented around the group. And so the rugged individualism of the American that says, you're not going to mess with telling me what to do and, you know, and make me line up in these boundaries. That's not nearly as big of a part of the Chinese thinking. And so I do think that there's a degree of willingness to accept some more extreme measures without considering the usefulness of those measures or whatever on the policy side. There is just a broader willingness in society to say, hey, some of my freedoms need to be limited for the well-being of other people. And I don't think that's a bad thing.
No, we have
obviously
people who are making Walmart the new shopping mall where kids can hang out and have a good time, and it's not about essentials, you know?
Yeah.
Right. Yeah. There's a difference between doing it voluntarily and, you know, having the government tell you to do it. And yeah, in here, sometimes we think maybe we wish more people would voluntarily be responsible in certain situations. So I see where you are with that.
Well, that's on the flip side of that. When people aren't, let's talk to Beth for a second about, Beth had a post on Facebook the other day about her experience as a nurse walking through the hospital and the feeling that she gets, and being in an area that none of us can go. I know of another agent whose mom just passed away of something else, and he said it was a challenge for them to get to go see her just because of all of this. And Beth had a little bit of a insight into that about where everyone is and how it's kind of taking over the hospital. Why don't you tell us about that a little bit?
Yes, so I would say, to preface this, I am not one of those people who freaks out about germs. I'm not like super, you know, OCD when it comes to stuff like that. But walking into the hospital during this time, it is so different, like 180 degrees different from how normally I would feel at work. I don't get stressed or feel tension at work, but now, I mean, there's just something in like the atmosphere that changes everything. And I think that, you know, because of all the COVID patients or the patients that they want to test for it, they don't want to put those patients with, I would say, normal patients because they don't want to risk infecting them. So they're having to shut down entire units and transition that unit into a COVID only unit. And then they have other floors that are COVID testing floors. So they haven't been tested yet. So someone might turn out not being, you know, positive for COVID. And then they've been on that floor for 3 or 4 days while they're waiting for their test results, among all these other patients who may be positive for it, and nurses coming in and out of those rooms. So it's just kind of weird, like thinking you don't know who's got it, who doesn't. And then all the staff people that work on these units normally are all being moved around because of who knows how to work the ventilators, who's allowed to go in the rooms. They don't let the aides who we normally have helping us, or the lab techs, anybody like that who would come in and do those blood draws and extra things, vital signs, stuff like that. They don't let them come in the rooms anymore because we don't have enough supplies to be able to share them with everyone else. So it's kind of all falling on the nurses. And then, I mean, I'm a cardiac nurse, but I'm not an ICU nurse. So I can't even go in the ICU rooms unless they need a second person in there to give them a hand with something. So what they're using us for is sometimes we're going into the ICU unit to be a runner for the ICU nurse because they can't be coming in and out of the rooms to grab stuff. So they'll go into the room and they'll stay in the room for as long as they need to as much as they can at one time. And if they need more medicine or they need extra supplies they ran out of while they were in there, we as nurses can log into the machines to get all that stuff where the aides can't. So it's very weird because we're just doing jobs that we wouldn't normally have to do, or nurses getting paid to sit in the front lobby and screen everybody who's coming in, all these employees, or a physical therapist who isn't working right now because they're not needed as much. They might be sitting in the front lobby screening people as they come in. So everyone's just kind of in a different work area than normal. And then just every time you walk into a room where, especially if you know that person is positive for COVID, it's just this eerie, weird feeling because I don't think it's just because the social media makes it that way, or the media, the news in general, but it's just something about like knowing that you're walking into a room with someone who has this disease, and you don't have all the supplies that you would normally have on your face or covering your scrubs and going into that room. And then you come home and you're thinking about bringing that into your house with your family. And it's a lot of pressure.
Beth, thank you. I just want to say that because, I mean, I've been sitting in my garage for 10 days and look at what the rest of thank you so much for everything you're doing.
Right.
Well, I appreciate that. Thank you.
And so it sounds
I will
like,
say people were like very surprised. I'm sorry. People were very surprised saying that, we thought that it was just the news blowing this all up or whatever, but it really is not like that. And we weren't even hit first. Like Detroit, was getting slammed, but we hadn't gotten a patient yet. And then we started preparing for it. And then, it's just like one after the other. They keep coming, and I think we have 5 units now that are converted to COVID only units, which means that all these normal cardiac patients or people who would normally come aren't going to come, or they are and they're going to put themselves at risk. So it's just kind of a mess, and everything's changed every couple of days. It seems there's a different change, different policy. So it really is, I'm not saying that the news is always going to be right, but it really is as scary as they're making it sound.
So it sounds like there's usually a lot of specialization within nursing, as far as like you have one patient and this person does that and this person does that and this person does that, but right now that's just gone. They only got one person getting the control of the whole case until they're off shift, right?
Pretty much, because we don't have enough supplies. I mean, I know a phlebotomist came by the other day and wanted to go in a room and draw some blood, and I was like, well, we're out of gowns, we don't have any more. And she's like, what am I supposed to do? I'm like, well, I guess I can go in and try to do it, or we can put a trash bag over you, like they're coming up with crazy stuff to do to make it work to where they can go in there and do their job. So, and that wasn't even a COVID patient. That was just somebody else who needed isolation precautions. So we don't have the proper stuff that we were trained to do. And it sounds like the hospital is kind of having to create their own precautions. They're not all CDC approved. And the CDC will say, this is what you need to do. This is how the precautions should be. But if our hospital doesn't have those supplies, we can't abide by those precautions. So you have people wearing covers over their shoes, but they're wearing the one cover the whole shift. And they're walking in and out of 4 different people's rooms and down the hallways in these same shoe covers because we can't afford to switch them out every time we go in a room. So that's not how we were trained. It's not right. But we have no choice. What do we do?
Right. Are you guys are you in a position where you're trying to get to Home Depot or one of these places to get your own stuff? Like, are you guys?
Some people are. So I know that the companies that supply masks and gloves and stuff like that to hospitals, they have put a lot of restrictions on private buyers. So if I were to personally try to buy myself a extra disposable surgical masks or whatever, I probably wouldn't even be able to right now, because I know they're kind of saving them for the hospitals and they're trying not to let private parties buy them. But I know some friends have gone in and bought some P100 masks, these, big old face masks, and other people are sewing masks for the nurses. Every day I walk into the break room and there's a whole new box of masks that somebody brought in for the nurses and or sent in. So, we have more to go through, and then we can rewash them and use them. But those are not protective at all. I mean, it's just covering your mouth.
It just keeps your spit from getting on somebody else.
What's that?
It just keeps like your spit from getting on somebody else is all it's doing.
Yeah, I mean, it's not going to prevent any airborne disease. And what we're using them for is we have an N95 mask that was kind of the old school way to prevent this kind of disease. They've come up with better stuff, but we can't afford to provide that many, I guess, for everyone. So now we're going back to the old school N95 masks, and those we're only supposed to wear for 40 hours max is what our hospital told us for patient care. But I'm hanging on to mine as long as I can, because we don't know if we're guaranteed to get another one. They say that, if you ruin it or soil it, whatever, you can get another one, but there's no telling when they're going to have them and when they aren't. So we're putting the homemade masks over top of those to try to preserve them as much as we can.
Okay.
But
so, Nate, how is the supply chain over there? I know China obviously produces a lot of stuff. So did they have any shortages?
Yeah, there definitely were shortages. When everything went on lockdown, immediately all pharmacies were just pounded. And so I took a trip around my area here, my community. I visited 7 pharmacies and I couldn't find a mask, because it was actually required for everyone to wear masks. If I wanted to go out, I had to have one on, and I couldn't find one anywhere. And so there was just a major craze of buying, hoarding, that kind of thing. And then they started taking over factories and saying, you got to start putting them out and producing and stuff. And so at this point, there's not a shortage. Now they're starting to export, and there's some sticky issues related to that. But yeah.
So Kevin, can you imagine a world where our governor says to leave the house you have to have a mask on? If we didn't have the supply chain issue, and how do you think people would respond to that?
I mean, I don't know if I can imagine that as a requirement, just because, yeah, I mean, you said it, the supply chain issue, and just the fact that how would you enforce that? I mean, I just think that would be too police state-ish, not that I don't think it would be a good idea, but I just don't think that people would take well to that.
Well,
but I can see
Nathan, how they did police that.
Yes, I know. I
mean, did they get? Was it a fine? What was the repercussion if you went out without one?
So it's interesting you ask, was there a fine? There were news reports of fines and things like that, of people getting in trouble, but in general, Chinese society isn't built around the structure of law. It's built around the structure of relationship and face. So it's just a matter of honor and shame. If I go out without a mask on, all my neighbors are staring at me and they're like, dude, what's your problem? Put a mask on. So it's societal pressure. And that works way stronger than an arbitrary law within Chinese society.
And to answer your question, Jeff, I think I could see us, getting to that point if the supplies were there. And I could definitely see recommendations. The federal government's already talking about it, obviously, recommending that everyone wear a mask. So, it would be great. When I went out today to the store, probably 25% of the people that I encountered were wearing a mask. And so the numbers are going up. And I think it's definitely not the whoa, that's weird kind of thing that it would have been, even just 2 or 3 weeks ago.
Another factor here in Asia is that this has been going on for quite some time. I mean, this isn't the first time that there have been these kinds of issues. So people have they've had a chance to warm up to the idea of people wearing masks for a variety of reasons. I mean, there are certain days where the pollution's so bad here that I'll go out with a PM 2.5 protection mask. And so that, it makes it less like spooky, like, sci-fi movie kind of thing. And it's just a more normal part of life.
I remember newscasts with SARS and the bird flu and all that stuff, and they always showed Asian citizens with masks on. So we're used to seeing that. We're just not used to seeing anybody other than a doctor with or a drywaller with one here.
Right,
Mhm.
right.
So Beth, what do you think? How do you think at least our area? For anyone who doesn't know, we're an hour north of Detroit, let's say, and Beth's at the biggest hospital in that area. You go another 20 minutes north, and there's a couple other big hospitals. But how do you think our restrictions are being taken? Like, are we taking them seriously enough? And do you think it's going to be a while before we see changes in what's going on in your hospital?
Well, I thought, just based on, I don't know, seeing people around the grocery store, like you were saying, Kevin, with masks on and everything, that people were taking it seriously. But you referred to my Facebook post earlier in this recording. And I was very, very shocked. I just gave some insight on kind of like what's going on in the hospital. This is a real thing, wasn't trying to be overly dramatic or exaggerating anything, but just factual information. I was not expecting the response that I got on there. And a lot of people's comments that I noticed were saying, wow, we didn't realize the seriousness of it. Like, we just thought the news was blowing it up. Like, we did not realize that this was actually like this for you guys or whatever. And so I feel like people think that it is more of either a political scheme or just the media wanting more attention or something. I don't know. But I don't think that people are really getting all of the inside scoop of things. And, just being able to share that with them, I think, was pretty valuable. But I think the restrictions honestly can't be tight enough. At first, a couple weeks ago, I was like, oh, great, really? Like, how is this, And I just, I'm not typically one of those people who's going to freak out over stuff like this. But as the weeks have gone on, and I mean, in the past, it's been like 22 days, I think, since our first patient in Michigan or Genesee County. I don't know what the specific stat is on that, but just in the past 22 days, we're over like 7,600 confirmed cases. And that's just the people that they're testing. So I feel like there are a lot more people out there who probably have it or maybe have very, very mild symptoms and don't even realize it. And the fact that that's just the tested number of cases right now is kind of unbelievable how rapid it's growing in our area. I know it's not like that in every state, but in Michigan, I mean, a couple of days ago, I know we were in the top 5 states with the most cases, here in the US. So it kind of shows you that, yes, it is a serious thing. People were saying in the beginning, oh, it's just like the flu. What's the big deal? But obviously, the whole world doesn't shut down for the flu, and we see the flu all the time, and it doesn't quite put people in the state that the COVID is. So, and the most common misconception, I think that a lot of people are freaking out about unnecessarily, are that it does really only, I don't want to say it only affects, but it mostly affects just those high risk patients. So the people who already have COPD or asthma or heart failure, kidney problems, people who have big issues already, they get COVID, and that's not a good situation for them. But someone like me, I honestly don't fear myself getting it. I mean, I would hope that if I got it, it would go through my system like a normal flu would. But I fear my 2-year-old coming home to my baby who doesn't have as strong of an immune system and, bringing that home to her or, sharing it with whoever. So there's a lot to think about there, but I do think that our county has gone to, pretty crazy extremes, shutting down everything, but I don't know, the drive-thrus are still open, that kind of stuff's still open. We go get takeout and, you can't help but wonder, did somebody cough or sneeze on my food? Like how safe is this still even? But
it's all home cooking here. All home cooking here. I won't.
I stopped my coffee trips. I don't even get coffee anywhere.
We had to get Chick-fil-A. I mean, we had to support this.
Chick-fil-A is essential.
Never had Chick-fil-A.
Don't talk about Chick-fil-A. You're killing me. You're killing me.
They got other kind of filet in China, not Chick-fil-A.
The thing is, though, I don't think that even all these extremes that we're taking, it's not like this is going to go away in 2 weeks. There's no way that all this is going to go from 7,600 to 0 in 2 weeks. And hopefully we'll get a lot of control over the next couple of weeks, but the numbers are only going fast. So
And
to me,
you
that's
know
kind
what, Beth, I want to tell you too, that I'm learning, and I appreciate your perspective from inside the hospital, but I'm learning that there's always so much more that you can do. I mean, as somebody who was taking this seriously from the beginning,
right.
you know, I found out today that I have friends who are coming into their garage, changing in their garage, they come home, taking a sanitary wipe, using it to open the door, come in, get soap, wash hands, you know, all of that. And it was a wake-up call for me, even because my wife tried to Lysol me when I came through the front door, and I'm like, we don't Lysol human beings. That's not what we do. And, you know, but then I realized that maybe there are some additional things I could do when I'm home.
A lot of nurses aren't even going home. There's so many coworkers I know who are staying in hotels. Even if they have kids, I mean, the other spouse is just, you know, carrying the load there at home. And it's really, really sad to see the families torn apart. But in my head, I'm like, what if this goes on 3 more months? Like, how, you know, how do you keep going like that? But they're terrified, you know, to bring it to their home. So I know for myself, we get scrubs at the hospital. When we get there, they give us hospital scrubs to change into instead of wearing our own, and unit in those scrubs and then change back into our scrubs before we go home. So at least we're not wearing those same clothes, but I mean, our shoes still and all that, our badges, like we all disinfect, bleach everything before we leave the hospital, and wear the mask all the way up to our car. And then, you know, most people would just, you know, have a changing station in their garage or on their porch or wherever, and they're literally just like changing everything before they walk in the door because they don't want to take our shoes off before we walk in. Sometimes I take them off before I even get in my car. So it's crazy, but.
Wow.
Well, we appreciate you, Beth, and thank you all for coming on. You got any final words, Nate?
Yeah, I mean, we can't be sure about the nature of the situation here. But one thing we can be sure is it was taken seriously at a certain point. And because of that, and because of what, you know, some people call draconian measures, there was a significant stopping of the problem. Hospitals are not full of patients right now here anymore. And I think a large part of that is because they eventually took serious action at a certain point. And so I think that is, while we have questions about what has and hasn't happened here, and we can't be sure about numbers, we can be sure at least of that much. In our province, in our city, they are almost past it, and I think a large part of that is because they took action like they did. So
Good. Kevin?
Just stay safe, everybody. You know, take what we've learned and apply it. And like Beth said, you know, it's not just about you, it's about others, and you can carry this without ever having symptoms and pass it on to somebody who's vulnerable. So so be safe, be smart, and I'll be here to sell you a home when it's all over.
All right, Beth, you get the final word.
Final word. I'll end with a quick, tiny story. This mom that I am friends with, she's probably in her young 40s, I'm going to guess. Her husband was actually in the ICU with COVID, and they're personal friends of ours. She sent me a message yesterday just saying, I'm so sick and tired of seeing all the jokes on Facebook and everywhere about this COVID and people just not taking it seriously because my husband almost died. And he's young and healthy, but almost died in the ICU at my hospital with COVID. So I would say just definitely take it seriously. Stop making a joke about it. I know we have to find, you know, comedy in life and everything, but this is one of those things that it is affecting people very hardcore, very personally. And if it's ever going to hit your family, it's not going to be fun. You know, keeping wise, be calm, but be wise. And yes, wash your hands, keep your 6 feet distance, and don't come to the hospital if you're sick.
Face, right. All right, well, thanks for coming on, guys. Tomorrow I have Mary Johnston from Berkshire Hathaway coming on with me, as well as a friend, Evan Cruz, who works in Lansing, their state capital, with the House of Representatives. And also we have a COVID patient who was in the ICU, another friend of mine. So hopefully we can get the live to work tomorrow. But thank you guys again. And I appreciate your time. And thanks for all who watched.